We've been granted rare access into Kenya's isolation wards for COVID-19 patients. This is Mbagathi Hospital in Nairobi. It is ground zero for COVID-19 medical response in Kenya. Once a person is suspected to have contracted the new coronavirus, they are placed in this section where they are tested, and if confirmed positive, they are moved into the isolation wards, a tightly controlled and monitored area. The health workers here prepared us to go inside the wards to get a first-hand experience of just how complex the response is for those dealing with a highly infectious disease which has no known cure. This thing is a lot about teamwork, huh?
Yeah. Oh yeah. Even when you're joking, you're watching each other, you're reminding each other.
Only shoulders.
Don't assist.
When mistakes or accidents happen, the repercussions are grave, and it could mean that essential health workers who are needed on the front line are forced to be grounded. This second part of our special assignment takes us into the shoes of our frontline responders to examine the threats that Kenya's health workers face while in the line of duty, and to examine government's preparedness to support crucial aspects of the healthcare system. This is the infectious disease unit at the Kenyatta National and Referral Hospital in Nairobi. This is where Kenya's first two COVID-19 patients, Brenda and Brian, stayed during their recovery. Dr. Samuel Njenga runs a tight ship here. His experience as an infectious disease specialist is rooted in the response to the Ebola crisis.
During that Ebola outbreak, all suspects for Ebola virus disease were managed from here. But fortunately, during that time, we never got any confirmed case of Ebola.
Dr. Njenga says he will allow us into the isolation wards, but we must follow all safety routines. Behave like health workers, he tells us. While Mbagathi Hospital hosts most of the confirmed cases from the general population, Kenyatta Hospital is taking care of health workers who have either tested positive or are suspected to have contracted the new coronavirus.
Quarantine is not for doctors. We are quarantining anybody, all healthcare workers who have been in contact. Not necessarily they are positive. The ones who are positive, I'm sure you saw them there.
At the IDU ward, we meet 54-year-old Stephen Hagai. He's a health worker, a cleaner. He contracted the virus while working at the wards at Mbagathi just a week ago. Dr. Njenga has allowed me to go into Hagai's ward for a conversation. I've donned the personal protective equipment. But the doctor wants us to keep our filming equipment at a safe distance, so our cameraman will film from outside the window.
How many days has it been now, unasikiaje?
Leo ni siku ya 10. Hakuna kitu nasikia. Sikohoi, kisimizi.
Kwa symptomatic kabisa.
Once you know you have been in contact with somebody who has tested positive, we quarantine you.
How many health workers?
I would not have the figures overhead, but we are ranging now around 40, 50, around there. Because some of them are mine and I am protecting them. Luckily, we have also tested them now. They are all negative. Now we are waiting for time until once we clear them, the 14th day, they come back to work.
The latest situational report by the World Health Organization says that as of 8th of April, more than 22,000 COVID-19 infections were reported among health workers in 54 countries worldwide. With more than 50 Kenyan health workers in quarantine or isolation, government must now act fast to address the possible gaps. The first is to work on the numbers.
The numbers of healthcare workers that are going to be needed for this response are phenomenal. For sure, we've always had a gap. We've never had enough healthcare workers, and it's never been more apparent than now when we realize that sometimes if you're going to have healthcare workers who may be exposed and may have to be exited to quarantine because they have been exposed, then you need healthcare workers.
The state wants to hire an additional 8,000 healthcare workers to be deployed across the country for the COVID-19 response.
Under the universal health coverage, we had already started the process of recruiting over 8,000 workers, different cadres for all the counties in the country. We had also, under the same universal health coverage, begun, and actually some counties have deployed 4,000 interns. And in addition to that, now for COVID, we've only had to invest an additional 1 billion, which will go towards recruiting the more specialized health workers for the ICUs, for theater.
If Kenya is able to boost the numbers within the next few weeks, another big task will also be staring at government: training.
We have to make sure that even right from the lowest level, because not everyone is going to come to a high facility such as where we are, they're going to start from the lowest of facilities. So how the healthcare workers should be able to identify what are the signs, what are what is at high risk for a COVID worker.
The Health Ministry says they have partnered with medical professional bodies in the country to train healthcare workers on how to use protective kits and how to follow required protocol when handling COVID-19 patients. This training will have to be done virtually. But as we have learnt during our time with the teams in the 2 hospitals, wearing and removing this protective equipment is no walk in the park. In the beginning, we first observed Dr. Njenga and Nurse Angeline as they went through the process. They have a buddy system where they check on each other to ensure that they have worn the gear correctly. And then it was our turn. The recommended practice is that you have someone supervise you as you wear the PPE. Ruth, the head nurse, will be my supervisor for the day. This process is called donning. First step is to sanitize correctly. Wear the boots, then the coveralls, the hairnet, and then the first pair of gloves, which will be the tightest layer of protection for my hands. And then it's the N95 mask, and then the goggles. An apron is then added on top of the coveralls, and then a second pair of gloves. At this point, it's almost impossible to identify the person under the gear, and so the head nurse writes your name and your designation.
By writing your name, you are humanizing yourself. You are also explaining what you are likely to be doing in her space.
On the arm, the time that you're entering the wards is noted. Everything is documented to ensure accountability. When inside the patient's area, you're encouraged to avoid touching surfaces or items. However, it's common that a health worker would need to touch the patient or to clean up bodily fluids. They would in such cases be required to remove the outer gloves, sanitize, and then wear a fresh pair of gloves.
On a morning, you may have like minimum 6 people going to the patient area. They have to wear full PPE. And some of these activities are repeated in the course of the day. The nurses will go in the morning, they'll go back before midday, and they'll be back in the afternoon and in the evening and at night. So if you look at the nursing staff working with 2 nurses going to the patient side, and they are going there like 4 times a day, you're already using 8 PPEs.
Of course, it's challenging. One, it's quite challenging. 2, somehow it is like I say traumatizing. But we go a lot of support, psychological support, which is done.
Wearing the PPE is perhaps the easiest part of this process. Removing it, or what they call doffing, is much harder. We are told this is where most health workers contaminate themselves and get infected. And so in their training manual, government will have to focus on this process before they can deploy the new healthcare workers to deal with COVID-19 patients. We could already see how difficult it was for our colleagues from the Nation newspaper to remove their PPE. Now, it's our turn.
Not near there, up. Up.
On the yes, good.
Cut.
Dr. Njenga and Nurse Angeline supervise my every move.
Sanitize.
At last, we are out of our contaminated suits, and the last step is to wash our hands thoroughly with soap. We can't help but wonder just how effective the training on this crucial process will be for health workers across the country, especially if it's all done virtually. Our equipment has been thoroughly sanitized and decontaminated. For all the PPE that we have used during our filming, Citizen TV will be replacing them. As we leave the hospital, we go through another set of precautionary measures from our Royal Media Services COVID-19 team. Handling the coronavirus disease has been the test of times for healthcare systems across the world. Economies with much superior systems have crumbled when the number of patients overweighed the capacity of their systems. For Kenya, the experience in dealing with infectious diseases may be an added advantage. But with issues like recruitment and training yet to be finalized, officials can only hope that an influx of patients is not around the corner. Asha Mwilu, on special assignment for Citizen TV.